Good afternoon, and thank you for joining today's webinar, Leveraging TANF to Improve Outcomes for Survivors of Intimate Partner Violence. We are excited to have a panel of expert presenters join us today. My name is Carol Mizuguchi. I am a Family Assistance Program Specialist with the Office of Family Assistance, and I will be facilitating today's webinar. Again, thanks to everyone for joining. So according to 2013 data, up to 74% of TANF temporary assistance for needy families participants report recent experiences of domestic violence compared to 30% of the general population. Survivors are often isolated from family, friends, and financial resources as a result of a perpetrator's tactics to maximize the survivor's level of dependency on them and decrease the likelihood that a survivor can gain self-sufficiency. TANF and other public assistance programs have a unique opportunity to provide necessary financial assistance and access to critical resources that can help survivors and their children move toward greater independence and self-sufficiency. In recognition of Domestic Violence Awareness Month, this facilitated webinar will share key findings about the economic toll intimate partner violence takes on survivors and strategies for best supporting survivors that are accessing public assistance programs. So before we get started, let's review how to use GoToWebinar. In your upper right corner of your screen is the control panel. You can minimize or enlarge the control panel by clicking on the orange arrow. By expanding the control panel, you can scroll to the bottom to type any questions you may have and provide responses to our polling questions. You'll see we have 3 throughout the presentation. Please enter your questions throughout the webinar and indicate which speaker you would like to respond to. Your question. So if you have a question, you have a specific person that you would like to have them answer your question, please indicate that when you ask the question. At the end of the webinar, we will also share the PeerTA website, the URL, so that you can later access the transcript and audio recording of today's webinar, as well as useful resources. To download the handouts referenced in today's webinar, click Handouts in the menu located on the right side of your screen. We will launch several polls throughout the presentation, which you can respond to by clicking on the radio button next to your preferred response. We will leave each poll open for approximately 30 seconds. In today's webinar, we're going to describe key findings related to the impact of domestic violence on survivors and their use of public assistance benefits, identify principles and practices for best supporting survivors, and explore examples of successful survivor engagement within the TANF program. So we are very fortunate to have a wonderful panel of speakers with expertise on this topic who will guide our conversation. We will hear first from Kenya Fairley. She is the Acting Director with the Division of Family Violence at the Administration for Children and Families. Kenya serves as the Acting Director in the Family and Youth Services Bureau at ACF, which administers the Family Violence Prevention and Services Act, which is the primary federal funding stream dedicated to the support of emergency shelter and related assistance for victims of domestic violence and their children. Kenya has been an advocate devoted to ending domestic violence and sexual violence against women and girls for 20 years. So we're excited to hear from Kenya today. And next we will hear from Miriam Durrani, who is the Director of Policy at the National Resource Center for Domestic Violence. She joined the National Resource Center on Domestic Violence in October of 2018, so she's new to the organization. She has a background working with victims of domestic violence with the focus on immigrant, faith-based communities and limited English speakers. Her experience also includes work at the national and state level where she advocated for strengthening federal legislation to support domestic violence victims and at the Virginia Poverty Law Center. She has litigated family law and protective order cases for victims of domestic violence and sexual assault. She has also worked on the House Judiciary Committee and is a certified mediator. She is passionate about ensuring that all federal policies address diverse and unique needs of all survivors. So welcome, Miriam. We also will hear from Oregon Department of Human Services and their partner, Haven from Domestic and Sexual Violence. So we have Amber Harchuk. She is the Temporary Assistant to Domestic Violence Survivors Policy Analyst and DHS Domestic Violence Co-Located Advocates Program Coordinator. Amber's previous experience with the Oregon Department of Human Services was working in a field office in various positions. And prior to her current position, she served as a lead worker. Before starting at Department of Human Services, Amber gained experience in training and program coordination. She also was a domestic violence and sexual assault advocate in Michigan, and she is committed to continued support of advocates in their roles with families. And finally, we'll hear from Jennifer Pauletto. She's a graduate from Portland State University. She graduated in 2009, receiving a Bachelor's of Arts in Social Sciences. She has worked and lived in the Columbia River Gorge for the last 7 years and is a native of the Pacific Northwest, as am I, so we have that in common. And before working at Haven, Jennifer worked with children and families throughout Head Start as a teacher of English as a second language and as a therapeutic foster care case manager. She has worked for Haven from domestic violence and sexual assault violence since 2013, first as the co-located domestic violence specialist stationed in child welfare and self-sufficiency for the last 2 years, and then for the last 2 years as the direct service program manager in charge of program building, training, and supervising 7 advocates and training community partners in the dynamics of violence. And it goes on to talk about some of her hobbies and the whole bit, and I know she'll share more information about herself when she speaks. So at this point, I'm going to turn it over to Kenya. Thank you.
Hi, thank you so much, Carol. I appreciate that, and I'm very excited to be speaking on the webinar today. If anyone is having difficulty hearing me, please let me know in the public chat, and I will pick up the phone. I currently am using speaker, and sometimes that can sound a little distant. Going to the next slide, as Carol said earlier, I'm the acting director of the Family Violence Prevention and Services Act program, and we're located in the Family and Youth Services Bureau at the Administration for Children and Families. And we are excited to be a part of this endeavor for Domestic Violence Awareness Month, because one of our key themes for what we've been doing over the course of this month is leveraging resources and partnering across federal agencies to improve supportive services for victims of domestic violence. That's been our one thing to continue to ensure that services, supports, emergency shelter, and other protective factors are in place for survivors and their children. Go to the next slide, please. Here in FISB, our mission is really to support the organizations and communities that work every day to put an end to youth homelessness, adolescent pregnancy, and domestic violence. We believe in a future where all of our nation's youth, individuals, and families, no matter what challenges they face, can live healthy, productive, violence-free lives. And that really drives the work that we do here. Going to the next slide, I want to tell you a little bit about the Family Violence Prevention and Services Act. This act was first passed by Congress in 1984 as part of the Child Abuse Amendments. FIPSA made history by being the first time federal resources were dedicated specifically to expand and support domestic violence shelters, services, and programs. One thing that makes FIPSA unique is that we are really focused on community-driven solutions to address domestic violence and promote partnerships amongst FIPSA-funded programs, as well as with our federal partners and with other community-based agencies, services, and supports. FIPSA provides funding for mandatory formula and discretionary grants programs, as you can see those listed on the slide in front of you. We also provide funding for a network of training and technical assistance resource centers, culturally specific institutes, state domestic violence coalitions, and the National Domestic Violence Hotline. So you'll be hearing from one of our federally funded resource centers and state coalitions on the call today. Going to the next slide, I just wanted to share that in this past fiscal year, FIPSA-funded programs served over 1 million victims. And that does include men, women, children, and those for whom gender was not reported. So through our funding at the state level, the states that we fund through FIPSA funds, they subaward to local public, private, nonprofit, and faith-based organizations that provide victims of domestic and dating violence with shelter, safety planning, crisis counseling, information and referral, legal advocacy, and other supportive services. The bulk of the survivors that come in for support through FIPSA-funded programs receive non-residential supportive services, and a little over 200,000 victims receive emergency shelter and supportive services. So going to the next slide, we're getting a little bit into what the FIPSA philosophy is, and you'll hear more about that in the presentations that are coming up, but we really believe in promoting interventions that are grounded in evidence and that can be tailored to meet the individual needs and be responsive to the risk and protective factors of a very diverse set of individuals that may come in seeking services. We also are very focused on providing trauma-informed services and environments that allow for healing and recovery from violence, abuse, and neglect to effectively take place for those that are coming in seeking support. On the next slide, I want to explain what we mean when we talk about domestic violence. I think a lot of you on this call understand what domestic violence is and may be familiar, but to ensure that we're all speaking about the same thing, when we talk about domestic violence, we're typically talking about relationship abuse and tactics that are used between one person towards another person with whom they have an intimate relationship or partnership, and that abusive person may be using tactics of coercive control to exert power over the other person. So that power and those coercive tactics may show up through emotional abuse and manipulation, actual physical violence that may be enacted upon the other person. That can happen one time. It could happen multiple times. It oftentimes may increase in frequency and become more severe over time. But it can also just be a one-time occurrence that then also has these other factors that contribute to the relationship being very toxic and abusive. It may also incur stalking and monitoring of daily activities, which could include calling someone at their workplace frequently throughout the day, constantly monitoring what that person is doing on social media or on their cell phones and other devices. And it can include showing up at a person's place of employment, their place of worship, the child's school, and other things like that to really manipulate and control the victim. It also has a lot to do, and I think we're going to talk a lot about this today, with controlling a victim's money, sabotaging their employment, and harming or threatening to harm the children. And so you can see a lot of those tactics there, including sexual violence that can be used as a form of coercive control. This next slide just covers a few ways in which children are exposed to domestic violence, which oftentimes children are exposed to violence for the first time in their homes. And so they may see their parent being threatened, demeaned, or battered. They could be caught intentionally or unintentionally in a violent incident. They may see the after effects of abuse, so they may come from their room and see things destroyed within the home, chaos within the home, or wherever they may be. They may see bruises and other marks on their parents and other things that signal that there's been an incident that has occurred, and also just living in a household where there's this constant tension and stress and fear can also be emotionally damaging to children's development. The next slide gives a few more examples about how children are directly impacted by domestic violence, such as during their mother's pregnancy, with not having access to prenatal care or other appropriate medical care and attention that they may need. There could be challenges with bonding between parent and child that may be interrupted by the abusive partner. Manipulating the parenting authority of the victim parent in those situations, as well as just suffering from consequences of economic abuse that parent, who may be the primary caregiver or providing the primary care and support to their children, they may have to suffer from some of the economic impacts that they experience. And I also just want to note one key thing here is that oftentimes separating the victim parent and the child may cause further trauma. And so we really try to seek out and promote those interventions and supportive services that can provide a parent-child framework and that can be supportive to the healing of the survivor as well as the child together. So you'll hear a little bit more about that as we continue. This next slide just gives a couple of perspectives from survivors. I just wanted to bring those voices into this space. And these two quotes came from the annual domestic violence census count that's held by the National Network to End Domestic Violence on a regular basis, typically in September. And then they put out a report that provides statewide information, but also a national perspective of a point in time account and look at what's happening with domestic violence services. So you can see here one quote from that an advocate shared from North Dakota. It says, "We received a request for rental assistance from a woman leaving an abusive partner, but we were unable to help. She said, he controls all of the finances. I can't get out on my own. Many of our clients are unable to leave because of financial control." And the second one is from an advocate in Texas. And this person says, "A survivor and her 3 children arrived at our agency with nothing but the clothes on their backs after fleeing her abusive partner. She and her children hadn't eaten anything that entire day, and she had to leave medication for her son with special needs behind. We were able to give them shelter, clothing, and a hot meal and helped her to get her son's medication. She said she was grateful for a safe place to stay and so much support." So I think these two quotes just really illustrate the needs that survivors have in terms of being varied and diverse, but also being very specific to financial and economic security, as well as access to appropriate health care. So on this next slide, I just wanted to give you an array of the technical assistance and resource centers that we fund through PHPSA. Some of them you may already be familiar with, but all of our resource centers, they focus their work on strengthening community and systems responses to domestic violence. They all provide information, publications, research, technical assistance, training, and referrals. So collectively, you'll see on the next slide, we call this group our Domestic Violence Resource Network. And so you can see all of their names listed here. This includes the National Domestic Violence Hotline and their two special projects, Love is Respect, which focuses on youth dating violence, and Strong Hearts Native Helpline, which focuses on primarily services for Native victims of domestic violence, sexual violence, stalking, and human trafficking. So please feel free to reach out to any of those resource centers in the course of your work if you need additional information or resources on any of these specific system areas or culturally specific populations. And so as I get ready to wrap up this next slide, I just wanted to make you aware of this great resource that is also a project of the National Resource Center on Domestic Violence, who you'll be hearing from in a moment. Safe Housing Partnerships is really focused on understanding the intersections between domestic and sexual violence, homelessness, and housing. So there are some great resources that are available on that website. And this is also one of our key federal partnerships that we have with HUD, the Office on Violence Against Women, and the Office on Victims of Crime. And so we would love for you to just check out those resources as you're going about doing your work. And this last slide provides my contact information if you have any additional questions or just want to reach out for any partnerships or more information. And now I'm going to pass it over to the National Resource Center on Domestic Violence.
Great. Thank you so much, Kenya.
I think we have a polling question first. So thanks, Kenya. And at this time, we would like attendees to take a moment and tell us a little bit about your TANF program. So does your TANF program have policies and or written procedures beyond the family violence option waiver for serving survivors of intimate partner violence? So give you an opportunity to answer that question. I can't tell us. So, looks like the majority says here, oops, I lost it, sorry. 71% said yes. Wow. Well, that's great to know. All right, so thank you for your responses. And now I'm going to turn the presentation over to Miriam with the National Resource Center on Domestic Violence.
Thanks so much. So we are one of the resource centers that Kenya mentioned. Here's a little bit more about us and how to find us on the internet. We do have a lot of great, totally free, comprehensive resources, and we provide technical assistance. So if things do come up, don't hesitate to reach out to us. Next slide, please. So we know that intimate partner violence is super highly prevalent. Approximately 27.4% of women and 11% of men have experienced intimate partner violence in their lifetime. But more importantly, we also know that the burden of intimate partner violence is not shared equally across groups. There are many racial and ethnic minorities that are disproportionately affected by intimate partner violence. And the health and economic consequences of intimate partner violence are incredibly substantial. Apart from the physical injury and death, there's also health outcomes like cardiovascular diseases, gastrointestinal diseases, reproductive issues, nervous system conditions, along with mental health disorders like PTSD and depression. And a substantial portion of survivors also report other negative impacts like a fear of concern for their safety, missed days of work or school, and needing other services that really affect their well-being, their economics, and their health. So while we know that it's really common, on the next slide, the CDC actually has done a great job. A recent study that is a follow-up to a study that they did a decade prior that is trying to evaluate the lifetime economic burden of intimate partner violence across U.S. adults. Next slide, please. So what is a per victim lifetime cost? I encourage anyone who has access or is able to read this study who is interested in the cost to take a look at it is really just incredible analysis of all the ways that, intimate partner violence permeates our society, and not only permeates our society, but places an economic burden on the victims and our broader communities. So per victim cost here refers to the economic cost over a person's lifetime resulting from that person's exposure to intimate partner violence. The cost estimate also reflects the potential cost savings that would help with an intervention and to avoid exposure to intimate partner violence altogether. So previous studies haven't actually accounted for long-term health, but this does. So next, we talk about the key findings. The key findings are kind of mind-blowing when you look at the lifetime per victim cost. It was $103,767 for women and $23,414 for men. The difference between men and women in this case reflects the difference in outcomes like pregnancy, the difference in numbers of victims, the difference of research associated with male victims, and overall the study showed the lifetime economic cost of intimate partner violence is $3.6 trillion. And next, we talk about where those economic costs actually break down. And as you see in the lovely pie chart, that most of those costs are actually the medical costs associated with the violence. So that's $2.1 trillion. $1.3 trillion is about lost productivity, $73 billion with the criminal justice activities, and $62 billion other costs. So next we talk about why these are so valuable. If we reduce the number of intimate partner violence victims just by half, which obviously we want to eradicate it, but if we just think about half of that population, we would reduce the cost of individual victims and a society by $1.8 trillion. So this is some really great framing to think about, the economic resources that we provide, the social safety nets that exist, the benefit programs that there are. So all of these ways that survivors can help reduce the cost to themselves and to society. So next, we just wanted to share that the CDC actually released an intimate partner violence technical package, and it provides evidence-based practices on ending intimate partner violence. Next, the technical package actually includes comprehensive, affordable access to healthcare as a discussion point, responsive workplace policies, and the last three are actually have the most relevance, the TANF program, because strong economic supports for families, including work family supports and safe housing options, is a proven option to reduce intimate partner violence, also with the elimination of inequality and the support for survivors to increase safety and reduce harm. So next, we have a quote that just talks about the importance of the socioeconomic factors. Because this is an evidence-based package, it is really showing that poverty, financial stress, and low income can actually really increase the risk of intimate partner violence, and improving financial stability and autonomy reduces financial dependence, and it can reduce financial dependence on a perpetrator. It can provide healthy alternatives. It can, there are a lot more options available to a victim when there is financial stability available as well. And we know, some of that can even have to do with gender inequality in education and employment. There's so many vast contributing factors. So next, we talk about improving the household financial security overall. Increasing the income supports to low-income families can lead to the reduction in intimate partner violence. And, that's part of why TANF is so incredibly important. TANF and SNAP are programs, that from an evidence base show that they can increase economic stability. And, states can also implement policies allowing child support payments to be added versus offsetting TANF benefits. Things like tax credits also help lift families out of poverty, like the Earned Income Tax Credit and Child Tax Credit. So next, I touched really briefly, and everyone so far has touched on the vast impact and the number of victims that intimate partner violence creates. But now I really want to touch on the connection of domestic violence, sexual assault, and economic stability. We know that domestic violence and sexual assault occur across the socioeconomic spectrum, but there are just really unique challenges and barriers at the intersection of this violence and economic disadvantage. We know that significant numbers of low-income women are abused or assaulted, and the violence perpetrated against them often also makes it impossible to climb out of poverty. Abusive partners, as was mentioned at the very beginning, often exercise and maintain control over their partner and children. They sabotage their jobs, their ability to access their bank accounts. They interfere with employment. Sometimes they call and harass them. They run up credit cards. They ruin their credit card scores. Abuse can also result in victims who were previously not considered low income actually falling into poverty as a result of the abuse. So ending an abusive relationship can be this compromising, careful balance of losing access to a partner's income, maybe housing, employment, healthcare, or childcare. And these are all the difficult choices that victims have to grapple with. So furthermore, victims also, incur significant out-of-pocket costs while navigating the medical and mental health relocation systems. They might pursue legal remedies, which can also be really expensive. And the last thing I just want to make clear is that survivors from communities of color, Native American survivors, and those from underserved communities, including immigrants, individuals with disabilities, the LGBTQ community, they all often face intersecting issues that are disproportionately impacting them. And these issues can exacerbate and compound their vulnerability to poverty and economic instability. So next, we're going to dive into a report that is actually forthcoming. This one is not available yet, but it will be very soon. It is a joint project of the National Domestic Violence Hotline, the National Resource Center on Domestic Violence, and Casa de Esperanza, the National Latina Network. So what this report actually does, on the next page, we talk about the demographics that it covered, but it was administered to survivors who called the hotline and also through the chat feature. There were a total of 289 survivors who met the criteria, and the majority of respondents who responded to our survey were 92% identified as women, although there were also responses from the male, transgender, gender nonconforming, and genderqueer individuals. Most of the respondents were age 18 to 35, and almost 43% of them had children. The charts on the screen just show the breakdowns in a graphic format with pie charts and some numbers at the bottom. Nearly 20% of the respondents reported having been born in another country different than the United States, and the responses were actually collected from survivors living in 45 different states and U.S. territories. About 1/5 of the respondents identified as having a disability, and the majority of respondents, which is truly mind-blowing, reported an income of under $1,000 a month, including 23% who reported no income at all. So next, we know this over and over again, but the survey really made it clear through the lens of survivors. Survivors' ability to meet basic needs is absolutely central to their decision as to whether or not they can even leave an abusive relationship. So 67% of survivors surveyed said they stayed longer or they returned to an abusive relationship because of financial concerns, and 33% of survivors said they stayed longer or returned because they were worried about meeting their own needs or their children's medical needs without their partner's insurance or financial help. Another important thing to note that the survey showed is that survivors with children were significantly more likely to stay or return because of financial concerns when compared to survivors without children. So for even survivors who stated that they themselves did not need the programs, they know that they are an essential resource for those who do. So whether they have friends or family or other members of their community or other survivors that they know, they all highlighted that the fact that social safety net programs are essential to survivors' well-being. So next, the vast majority, 90% of survivors surveyed, said that public benefits are very important for being able to provide basic necessities. These programs, help survivors afford food, housing, healthcare, and they're an absolute critical bridge to safety and stability. So next we have some voices from the field. I think quotes are always great because it's in the voice of whoever responding to the survey, and in this case, it's direct voices from the survivor, and I think they're really powerful. So when trying to break free from an abuser, it may take us a long time to find our footing again. Without public assistance, this would not be possible. And all of the rest of them, just highlight that same emotion that survivors can't necessarily pay rent, they can't eat, they can't keep their kids healthy and safe without these critical resources. So next, we asked about the actual application of benefits. So out of the survivors surveyed, 40% of them applied for at least one type of benefit. About a third applied for health insurance, about a third applied for food assistance. Fewer survivors sought housing assistance and cash assistance, and 1/5 applied for all 4 of the programs. The frequency and types of programs that survivors actually apply for, what we've seen is it reflects both the need and also the availability. For example, survivors may have applied for health insurance because there are medical and mental health needs that originate from the abuse, and at the time there was a lot of accessibility related to insurance through the Affordable Care Act. And of the survivors who applied for benefits, 82% of them received them and 18% were denied. Of those that were denied, the majority of that was actually for housing assistance and cash assistance. So next, we talk about the barriers, through the survivor's lens. Of the survivors who did not apply for benefits, 98% of them reported barriers to applying, and the most common barriers were thinking that, the application might be denied and concerns they might have to report the abuse. When asked to explain, a lot of survivors described falling into a gap where they're ineligible because of their income, but still not having enough to make ends meet or provide enough for their children. And then there are also survivors who are still legally married to their abuser, so they are not meeting the income thresholds, and it's still, hindering survivors' ability to build their own financial well-being. And something that we talk about next is, there are other barriers that were not highlighted in the survey, but we talk about in the next survey that we get to, is that, there are child support enforcement cooperation requirements, there are work requirements, there's access to child and transportation issues, and we know that these are all running through the back of survivor experiences. So again, we have voices from the field, and a survivor saying things like, I can barely survive on what I make, it looks like I make money on paper, but I rarely have food in my house. It's a daily struggle for folks. So next, I just wanted to highlight a particular barrier that immigrant survivors face. There are access benefits that are really challenging for immigrant survivors in particular, with immigrants not being able to receive many public benefits for 5 years or longer, and then also the public charge rule that really limits dependency on government programs. And it means that individuals may be denied admission or their lawful permanent status. And it makes immigrant survivors particularly vulnerable to financial abuse and also unable to access the necessary support. And just a voice from the field, someone pointed out that, they didn't have their papers yet, so they worry about deportation, and their abuser, of course, just told them that no one would believe them, and if they applied for benefits, even if they were eligible, they would be deported. So next, we talk about the screening and disclosure of abuse. Of the survivors who applied for benefits, just under half, 47%, met with a caseworker or staff person at the public benefits program. And in only 1/3 of those interactions did the caseworker screen or ask about abuse. Again, this is just from the 287 sample size that we received, but the results are still pretty stark. And of the survivors who were actually asked about domestic violence, fewer than half disclosed the abuse, and the low rate of disclosure was attributed to survivors' comfort level and taking a trauma-informed approach. They were worried about the information getting back to their abuser. And one of the biggest issues is that a lot of survivors were not actually told about the family violence option under TANF, and the survivors actually were able to meet with a caseworker. So in terms of loss of benefits, which is next, this is not surprising at all, but of the survivors who received the benefits, 61% reported their benefits were cut or reduced later, and these survivors in particular experienced the most hardship with insufficient food, inability to pay their rent or mortgage, and not being able to afford their medical care. So on the next slide, we dive into the Resource Center's report that we did in collaboration with the Center on Poverty and Inequality and Economic Security and Opportunity Initiative. We decided in 2017 to conduct a survey of advocates who are working directly with domestic violence and sexual assault survivors to get a current sense of what public benefits mean, how they're working, and what role they play in survivors' lives. It builds upon a report that we did previously that just looked at TANF, but looking at what the CDC has recently put out in terms of their evidence-based practice, we looked at TANF, SNAP, and unemployment insurance. So next, there were 1,126 responses to the survey from all across the country. The majority of respondents are advocates of domestic violence or sexual assault programs, but they're also part of legal aid, social services, homeless, and housing agencies. The respondents represent individuals from every state. Next, this chart just shows the importance that advocates reported of TANF, SNAP, and unemployment insurance. We see TANF almost up there with SNAP at 84.6%, SNAP up there at 88.4%, and unemployment insurance with 54.2%. So next, we talk about how important these programs are to both domestic violence victims, who are listed up top in the pie charts, and sexual assault victims, who are listed down below in those pie charts. In addition to the overall sense of how important these programs are, advocates also share that significant numbers of victims need these programs to address their basic needs, as we already know. And it was also reported that respondents working with victims who are from historically marginalized or underserved communities really needed these programs more than the other populations that they were working with. So next, we have, again, the voices from the field. These in particular are highlighting TANF, SNAP, and unemployment insurance in particular. So just a quote that an advocate said that is really powerful: access to these benefit programs contributes substantially to victim survivor empowerment and post-trauma healing because it enables victim survivors to take steps towards addressing and remediating the trauma that they have experienced. So we know that it's incredibly important. So next, we start talking about the barriers again. Less than half of the respondents report that most domestic violence survivors they work with are actually able to access TANF when they need it. A little bit more positively, the majority of respondents said that they were able to access SNAP when they needed it, and 20% of victims reported that they were not able to access unemployment insurance at all. And the majority of respondents said that at least half the victims they work with need assistance from an advocate in order to even get the benefits. So explaining the programs, navigating the system, filling out the paperwork, getting all the requirements together. This is incredibly complicated for victims who are experiencing, multi-level trauma. So advocates are really crucial to making sure that survivors get the support that they need. So next we have some more voices from the field. I really encourage you to take a look at the report if you get a chance. It's highlighted in the handouts that are on the right side of your screen. You can download them directly from there. We have the larger report and also an infographic that just covers all of this. But the stories are really powerful and show, the biggest impact of what's happening. So next we have a quick poll for you, and this is not a yes or no question. This is just, what do you see as key barriers for survivors accessing TANF in your state or territory? You can just enter your answers in the chat box, and Jennifer is going to take a quick look at them and read out, some of the ones that really jump out.
All right, so if you can please take a moment to type your answers in the chat box, and as soon as I see some of the answers, then I will report them out. And again, the question is, what do you see as key barriers for survivors accessing TANF in your state or territory? All right, so some of the answers that are coming in have to do with mental health challenges or a fear of being reported to child welfare. Transportation is a huge barrier, as well as access to obtaining the required documentation. The income limits are very low and make it difficult for the survivors to receive TANF sometimes. There's also a fear that the perpetrator may be notified about the report of abuse. and how complying with child support as a requirement of TANF may interfere with that. And let's see, are there any numbers? Okay, so that's a question, which I'll get back to in just a moment. And then someone else mentioned that they are in a largely rural population with little or no access to transportation. So being mindful that transportation is a huge barrier, but even more complicated in rural areas. And I believe isolation and various offices being closed due to funding. Child support comes up a lot, as does transportation.
Great. Yeah. Jennifer, I think that, yeah, is a wonderful summation. And thank you to everyone who responded. You're absolutely spot on. In the next slide, we show the key barriers in the TANF system in a chart form. We see the percentages. Access to childcare is one of the biggest ones. And then everything that you guys actually said in the chat box is exactly what our report highlighted. Many respondents, something that is also really interesting, indicated that the core components of the family violence option don't always work well for victims. In particular, there's difficulties notifying the victims. Screening for sexual assault especially can be complicated. Exemptions for work or other requirements can be complicated as well. Respondents also described that sometimes victims have problems with the documentation required for the family violence option, with victims being required to obtain a restraining order, a police report, or a letter from victim service providers. We know that victims are not always accessing these mainstream systems, so it may be really difficult for them to comply with those. So next we have more barriers listed in chart form again. Obviously the biggest one is lack of additional supports for victims fully and meaningfully being able to participate in programs. Again, childcare, transportation, those are the biggest ones. So next, we know that there is a really big gap between the work that the domestic and sexual violence advocates are doing and then also the systems that they're operating in. Given everything we know that it's really important to have a relationship between the systems and the domestic violence service providers. So only about 1/5 of advocates working in domestic violence and sexual assault programs report that they work regularly with the offices in the area that administer TANF or SNAP. And many of them only work on a case-by-case basis only. But if they're working on a case-by-case basis only, they're not getting the training, they're not getting the up-to-date information that is necessary for them to really benefit and educate all survivors. And one of the lack of the sustained collaboration is that there's not a lot of information cross-sharing. So we know that this collaboration is critical, and that collaboration would start to help address the barriers that the survivors are facing. So last, I just wanted to highlight some of the proposals directly that were mentioned about the TANF changes. And this is just a general recommendation from the survey. We know that strengthening public benefits, policies at state and federal levels to increase the level of benefits provided, reducing barriers and increasing access for victims, and providing additional resources and supports like transportation, childcare, and living wage work that promote economic security for individuals, family, and communities will help survivors as a whole and help them rebuild and help their communities. On this slide, you see the TANF, what was mentioned for TANF in particular. And again, these recommendations from the survey are just trying to break down the barriers that were highlighted as the most significant barriers to accessing these programs that survivors highlighted. So lastly, you just have our contact information. If you have any more questions, feel free to reach out to me or our CEO. She worked heavily on the report. As you know, I just joined NRC, but I'm getting up to speed on all the reports, which has been incredible, and I encourage you again to download them and read them in your spare time. So thank you so much for listening, and I'm going to move it on to the next presenter.
Thank you so much. So hello, everybody. This is Amber Hartchuck with the Oregon Department of Human Services. And I'm excited to talk with you today about two of the programs that we have and kind of some of the ways that they work and how they function. And so one of them is temporary assistance to domestic violence survivors. And that's a program through self-sufficiency. And we'll talk about that one. And also our co-located advocates program, where our advocates from local DVSA agencies are actually co-located in all of our DHS offices. So as we move to the next slide, we will talk a little bit, just a brief overview about some of the things that DHS offers. So DHS has multiple branches. We have aging and people with disabilities, child welfare, self-sufficiency programs, which is where I'm housed and where I'll spend a little bit of time about today, our vocational rehabilitation services, and our intellectual and developmental disabilities agency. Really working with all of these different populations. And so if we go to the next slide, we'll dive into more specifically self-sufficiency. So some of the programs that we offer, like many states do, and you all know, is the SNAP, Supplemental Nutrition Assistance Program, our employment-related daycare program. We have refugee services, which is cash, medical, and employment services for some refugees that might not otherwise qualify for the other programs we offer. Our TANF program, our temporary assistance for needy families, and our TA-DVS program, which we're going to spend some time talking about as we go to the next slide. So I am excited to talk about this program. It's temporary assistance for domestic violence survivors, and it is a TANF funded program where we've applied the family violence option. What it is it's really a financial assistance program intended to support families that are experiencing domestic violence. So anyone who is working through a situation where they have that current or future safety risk really around their domestic violence can apply for this program and work with us. It's most often used when fleeing the abuse, and it's really a financial piece. It's a grant that will help support survivors and whatever their safety plan is, and we'll kind of dive into what that looks like. Some of the key eligibility factors are that they have to meet TANF eligibility. One of those things that they have to meet is it is intended for families because of that TANF piece, and so the qualifying factor is that they do have to have children. They do or be pregnant, and so they can have children or be pregnant. If the children are temporarily out of the home due to the domestic violence, that also qualifies for the program. They have to have a current or future safety risk. So something that either there's a current risk or there's something where if I don't make some changes or really safety plan now, I have that future domestic violence risk. And that's a qualifying factor. And they also have to meet our definition of domestic violence. And so if we go to the next slide, we talk a little bit about our definition of domestic violence. Ours is very broad. It's not just intimate partner violence. It's defined by statute. It's any of the following acts between family members, intimate partners, or household members. So this can be attempting to cause intentionally, knowingly, or recklessly causing physical injury or emotional, mental, or verbal abuse, intentionally, knowingly, or recklessly placing another in fear of imminent serious physical injury. Committing sexual abuse is defined in any degree in our Oregon revised statutes, or using coercive or controlling behavior. So as you can see, this definition is really broad and it opens up to that intimate partner, family member, or households. There's a lot of relationships that will qualify. That intimate partner is also current or past intimate partner. And so kind of as we go to the next slide, how the program works. So someone comes in and they apply for the program. Again, they do have to meet those TANF requirements. One of those TANF requirements is also the income limits. And income limits for TANF are very low, but we can waive a lot of that income for this program as well. So anything, we actually look at it differently. We count what income they actually have today. Any income that is controlled by their abuser would not be counted, and any deductions that they have. So if I got paid today and I still need to pay my rent, we take that rent money out, and we really only look at what money they actually have available. Once they meet all of our eligibility requirements, they're approved for TA-DVS. That eligibility period is 90 days. There's no extensions to that. However, they can reapply if needed. It's up to $1,200 in accessible funds, and that accessible funds is really dependent on whatever they're needing. Oftentimes people are using that in order to relocate, but they can use it for whatever they're needing for their safety plan. And they just request those payments and we issue those payments out. And we'll talk about that as we go. They create a safety plan with DHS. And so really we look at a safety plan with them regarding these funds as well as their domestic violence situation and saying, how can we support you? What kind of resources, supports do you need? Really getting them connected with advocates, and we'll talk about what that looks like as we move forward. We talk about case planning, resource referral, really talking around, here's some things as you're working, maybe if you have TANF as well, we have case plans with all of our TANF participants. And so how can we include what you're working on in your situation into that as well and make a more robust plan that includes the participation that you're doing in other areas and really helping to support that TANF program as well. Once approved, someone can request payments. Those payments align with their safety plan. So they create a safety plan with us and say, these are the kinds of things and supports that I'm needing. And then they request payments. And if they align, we can make that payment. And really how does it help benefit in that safety piece? Safety plans, as you all know, change very often. And so those safety plans can change and the request for payments can also change. DHS will verify any payment request. We do this for a lot of reasons. One, to make sure that it's going to be beneficial for that survivor. For example, we verify any housing request to make sure that it's a valid, legal, where if it's a subleasing situation, that the landlord knows about the subleasing and that everything is going to check out so it's a safe and stable option. And verify any sort of additional costs. How can you receive the payment if we're making the payment? What does that look like? Payments are most often made to a vendor or as a dual payee, and so we're usually paying landlords, locksmiths, making a check out to if there's a specialty store that we're getting some sort of like a bed from, we can make payment out to that area, U-Haul, those kinds of things. And so a lot of the things that people request payments for that we see the most often are relocation costs, really looking at what does that look like. For relocation, do we need to fly you out of state? Is there a bus or train ticket we can get you across state or into a different location? Really helping with that first month's rent, security deposit if we've located new housing and that's where we'd like to move, how can we help support in making that payment? So looking at the rent, mortgage, if there's a mortgage cost that maybe we're needing support because of the domestic violence, we can look at that as well. U-Haul, gas, if I just need gas to get from here to Washington, what does that really look like? We see a lot of requests for lock changes, emergency moteling for that emergency sheltering piece, and storage feeds, helping to maybe I've got nowhere to be and so I'm putting everything in storage right now, but I can't lose all of the things that we have in our home. And so helping with that piece. All of those payments, again, are based on the safety plan and need. We do access other community resources, but really look at what's your safety plan and what are the things that you're needing and how can we best utilize this? $1,200 is a great amount, but it's also not the largest. And so really what resources do we have available for you to be able to make sure that we can make those payments? In the next slide, we're going to talk about our collaboration with our domestic violence sexual assault agencies. So we do have co-located advocates. It's a very exciting program. Let's go to the next slide and talk a little bit about them. Our advocates, we work with domestic violence sexual assault agencies across the state. There are 36 counties in Oregon and we contract in all of them. So we have providers in all of our DHS offices. They're contracted in both self-sufficiency and child welfare in order to help support and really help workers. I'm going to talk primarily about the self-sufficiency piece today, but there are huge benefits for our advocates being in child welfare as well. So the advocates are actually they still work for their agency and they sit inside of a DHS office and they help with consultations, with staffing cases, with really talking about safety planning. They can come with us. So some of those benefits of that is that they can support in creating our temporary assistance for domestic violence survivor safety plans. So as we're creating those plans, they can really come in and help guide that conversation, help us through that, give generic information about safety planning to our workers. They participate in meetings with DHS workers and survivors. So if we're working with someone and we want to bring in some additional support, the advocates can come in and really sit down and help guide that, be a support for the survivor so that they have someone that they're working with. they help survivors that are trying to access our funds. And so really, if they're trying to get that TA-DVS grant and they don't know how to navigate the system, the advocates can help work with, here's where you go to apply, we can go together, helping to navigate, here's how you request payments, and really helping to make sure that there's additional support for that. They also do an incredible amount of training and education for DHS. So they come to our staff meetings, they talk with us daily, send important emails, really helping to give training and education around domestic violence and how we can be trauma informed, really in specialized informations, pieces of training that specific DHS workers or offices. Maybe if my area is really needing some more information around human trafficking, the advocate can come and give a specialized training in that way. They also provide statewide training for us for Domestic Violence 101. So any DHS employee hired has to go to Domestic Violence 101 within 6 months of hire. And they are training those trainings for us as well to really make sure that we're all getting that updated information. And one of the big pieces that I don't think we can even share enough is that secondary trauma support for and advocacy for self-sufficiency and child welfare workers. Really, the advocates are there as support and advocates for anyone experiencing domestic violence, or if there's secondary trauma from working with survivors or cases, whatever that may be. The advocates provide ongoing support, really just being that person that is there for the workers to be able to ask questions of, to reach out to really have that ongoing support. Services include safety planning, risk and fatality assessments, shelter services, supporting and referrals to other community resources, and that huge confidential advocacy services for survivors and restraining order help. These are a lot of the things that we see most often is support from our advocates, and that's not all inclusive. They do so many wonderful things for us. And so as we go to the next slide, just to kind of highlight how much they really do. So working through some statistics, just some of the numbers that we have around how many people we see. From September to June 2017, our advocates saw 6,077 new families. So that's new referrals and people that worked with them, 6,077, and that doesn't even include the entire number of referrals. So how we really gauge our referrals and make sure that we're being trauma informed is we work together with our advocates to make sure that we are doing what is the best way to get referrals over to our advocates, what's the best way for referrals to be shared with survivors, and have that conversation. We have ongoing conversations with our advocates and with our DHS workers about what it really looks like, what confidentiality looks like. Oregon has privilege as well. So talking about privilege and how that information can be shared with advocates, and what it looks like to have information potentially shared back, and how to have that communication. That helps in that referral process. As we see the new families and the ongoing families, like I said, it doesn't capture all of our referrals, and the reason for that is that some families might have gotten a referral and were unable to engage in services. Just because of whatever is going on at that time. And so this is just the families that they were able to even get those services with, which is incredible. Our ongoing families are 4,481, and then 4,927 additional family members that were supported or helped through this co-located service. Our advocates have done over 10,588 safety plans on average. They do an incredible amount of safety plans with, and this is particular to just the people that they're working with from Department of Human Services. And on average, our monthly amount of families served is 1,047 families across the state that are really working through this. So we maintain that relationship by explaining privilege. We have domestic violence points in all of our offices. Those are DHS staff members that have updated information and training. They attend quarterly meetings with us and the advocates to really learn about domestic violence, learn about what's going on, and have that relationship building in offices to bring the advocate to meetings, really encourage them to come around. We have them, our advocates, attend staff meetings, sit in, listen, give trainings, talk about information, help in those cases. And so really being present in those meetings. They send emails with hot topics, important articles, did you know information. They participate on councils. We have a DHS domestic violence council, and our advocates sit on the council as well to really look at policies, procedures. They participate in work groups, different trainings, locally and statewide, to really offer that advocacy perspective on the things that DHS is working on. And they just overall provide their expertise in domestic violence. It's a really great program for us to have. In addition, we like to highlight on the next slide our Family Support and Connections program. And this is another program that works with TANF families and self-sufficiency that helps survivors as well. Family Support and Connections is really where you get a provider and we're working with them, and they give that hands-on, one-on-one, sort of like advocacy services to families with whatever they're working on. So if I really just need a counselor, they can sit down and help me figure out steps on how to get there. And so if I really just need some sort of information around parenting or around even organizing my home and budgeting, Family Support and Connections will sit with them and work through that. So the benefits of that program is it helps to strengthen families. It supports effective parenting. Parents can understand and use effective and nurturing child behavior techniques. All of the parenting classes offered through this are evidence-based, really working on how can we help nurture our children. And parents are able to get household items as well. So this is another resource where maybe they can get some cleaning supplies, diapers, bus passes, that transportation service. It's just another layer of that financial support where maybe we can utilize this as a resource to really help with those day-to-day needs of things that they're needing. And it's really for support for parents to help with child abuse prevention and focusing a lot on that child abuse prevention piece. Services include family assessment, budgeting, organization, parenting, supporting families, access to resources, transportation, getting kids ready for kindergarten. There's a lot of different services offered for families experiencing homelessness, really going on a case-by-case level of what information, what kind of resources, and what's the first step in getting those resources for you and helping with that. Just to highlight a couple of their numbers on the next slide, as we looked at the TA-DVS program, we want to look, or the co-located program, we look at FS&C. From October of 2016 through September of 2017, there was a total of 2,863 families referred to the program, and 2,519 of those families were assigned. Nearly all of the families referred were assigned and able to work with that. 3,280 children were served during that time period, and they provided direct contact hours, really having that hands-on connection with all of these families that they're working with. 23,998 hours of services provided specifically to these families. Those relationships are really maintained with having an open relationship with the providers for technical support, always being there to offer support, anything that they're needing and navigating our systems as well. Some of the providers are co-located in DHS offices. So our co-located advocates are co-located in every office. Some of the Family Support and Connections providers are co-located to help offer that additional support. They also attend staff meetings, and they have regular access to DHS training systems so that they can get updated information about what DHS is experiencing, how things work, and how to navigate that as well. And then we send resources in a listserv for all of the providers as well to make sure that they're getting updated information from us. So those are some of the programs that we have, and I'm really excited today to have Jennifer Poletto from Haven. Haven, if we go to the next slide, and Jennifer will kind of take over. Haven's one of our contracted domestic violence agencies that works with us and is co-located in offices. And Jennifer has great experience and will really talk about from the advocate side what it looks like to have that co-location. So I'll head it over to you, Jennifer.
Awesome. Thank you, Amber. So I'm really excited to talk a little bit about the advocate side of things. I have a lot of experience, as was talked about earlier, and we've talked about a lot of the struggles that survivors have in accessing the system of DHS and self-sufficiency more specifically. But I want to just kind of highlight to get started that not only are survivors being asked to navigate the system of DHS to be able to find healing and safety, but they're probably being connected with many other systems or being asked to do tons of other things by family and friends while still under the umbrella of a perpetrator continuing to manipulate and control them. And so really what co-located advocates do is that they support survivors in lessening those barriers to accessing services, and they support them in their path toward healing. And that looks a lot different for a lot of different folks. But on the next slide, we'll go a little bit into kind of where Haven is. A lot of people have talked about barriers of transportation and access to services in rural areas. And I specifically work in a very rural area of Oregon. We serve 4 different counties, and we partially serve, we support a Indian reservation that shares a border with another agency that we support in providing services to our Native population as well. And so we a lot of times focus on the services that are listed below, but really our job is to be as creative as possible in making sure that people have access to the services that maybe they wouldn't have access to if they weren't connected with us. So if, getting them a bus ticket or having a friend or family member get a gas voucher to get them to a nearby DHS office, that's something that we can provide. We've also been able to have intakes for the TANF program over the phone in certain situations when people are super far away from their nearest office. And so really that rural perspective is what I think really helps in the co-located process with DHS, is because a lot of our folks out here don't have as much access to general services, information, factual information, and they've also been usually told by their perpetrators a lot of different non-factual information in order to continue to control. So on the next slide, we'll talk a little bit about kind of what advocates do to support survivors accessing self-sufficiency programs, and specifically TA-DVS in our state. I really think that TA-DVS is a creative option that understands that not all mainstream systems for survivors will work. So not every survivor will benefit from a restraining order. Not every survivor will benefit from some of these common referrals that we make for folks. And so TA-DVS really honors that and accepts that you don't have to have a proof other than your experience of how you've been able to survive and what your safety concerns are. And I think that's really important in our state. So advocates are able to provide confidential, voluntary, and free advocacy services for survivors of domestic, stalking, sexual, and/or trafficking violence who might be seeking services through DHS. So those referrals might come directly from DHS workers. They might come from frontline staff who just know that someone might need some extra support in filling out paperwork or those kinds of things. And we could also provide referrals from folks who might come into our services through our front door, where we can tell them, maybe you don't think that you qualify for TANF, but this TA-DVS grant could support certain things that that you may qualify for that are over and above. Maybe you've applied for TANF before, it hasn't worked out for you, but TA-DVS is definitely worth at least applying for and learning a little bit more about the program. Our job is to meet survivors where they are and support them in creating and attaining their goals for safety and healing. Like someone said earlier, it's very different for every person. It changes a lot. And so our job is to kind of roll with that and help recommunicate with the workers about, reconnect with the workers about maybe a change in the safety plan, or, we were going to request rent, but now this house isn't as safe as maybe we thought it was before. So we need to think about other safety plans to be able to access those funds. So like Amber talked about, we help individuals understand systems, how to access them, support in coordination and partnership with self-sufficiency staff, and also really identify that a lot of people have felt failed by systems or fearful of systems for a lot of different reasons. So our job is to also help provide factual and informative pieces to be able to help people maybe go over that hill of understanding that maybe this service this time might be helpful. We also provide support in meetings and ongoing services, in part to access the TA-DVS funds, but also we support survivors at any point. So if they still don't want to apply for TA-DVS funds and then 4 months down the line they change their mind, we're here to help them go through that process. We provide training and ongoing education to staff, whether that's in a big group. Most of the time it's one-on-one. We go to each cubicle, we talk to folks about maybe something new that the advocate has learned, and then ask, what's new at DHS? What haven't I, heard about yet? Anything exciting that you're really looking forward to? We also are able to consult on difficult cases, whether we're working with the survivors or not. So sometimes DHS workers will come up to an advocate and ask, in this situation, do you see any red flags for domestic or sexual violence? And what are those? To be able to help workers really screen for those. And so it may provide them extra information or extra questions to answer, or ways to partner with a survivor who might be sitting in front of them to get them to either connected with us or to help them kind of be able to move forward with their next steps. We really help with the relationship building with workers. A lot of times survivors don't see their self-sufficiency workers more than like once a month or once every 6 months. And so we really are that conduit to help connect them back and forth and help provide information back and forth, as long as the survivor is consenting to that, to moving their case forward. We also really support, we know that supporting people who are in trauma can provide vicarious trauma to the ones who are providing the support. And so we also work really hard to make sure that the self-sufficiency staff feels validated in what they were able to do to help, whether a survivor decided to move forward with their safety plan or not, and really help them understand the dynamics of violence and kind of how folks make their decisions and what factors might be coming into those decisions. Whereas sometimes you might just see that someone has disconnected and you aren't sure why. We're able to be able to put some of those puzzle pieces together. And we also help in reframing victim blaming statements and modeling trauma-informed communication with DHS workers as well as survivors. We know that there's a lot of systems that don't know a lot about domestic and sexual violence, and so it's really easy to fall into victim blaming statements. And so what we do is we help reframe those and restate those in order to empower a survivor to move forward in those. We are a small agency as far as how much shelter we have, and so oftentimes we don't provide a lot of shelter, and so a lot of our safety plans we're using folks' natural resources in their family or friend systems, or we're helping them get connected to other agencies in our community. So sometimes we'll work with other DVSA agencies in other counties or other states in order to help a survivor get connected to a shelter if that's something that they want. But the other thing that comes up frequently is folks who come through and try to get the services a couple of different times because they're struggling to get out of an unsafe situation. And the great thing about the Oregon program is that whether you've applied for it and used it in the past, each time you apply, it's staffed with someone in Salem. So if, which is our state capital. And so if there's a legitimate safety concern in the eyes of the policy of DHS, there are many different ways that we can go about supporting survivors and reaccessing different funds to create a new safety plan. So we know that folks try on average 7 times to leave a relationship where domestic violence is being perpetrated. And so there could be a situation where you might need this program more than once or a couple of times as you try to leave a violent situation. The other thing is that we know that survivors sometimes get really connected with services and then disappear. And so we want to always make sure that people are always welcome back to our agency. And sometimes they might feel some sort of regret or disappointment for not being able to move forward with their plan as they had stated it. And so we can also help re-engage people to the DHS programs, because it can be really hard to say, you know, this just didn't work for me. Whether that feels like a personal fail or a failure of the system, it can just really be hard to re-engage in a system. So, you know, advocates do a lot more than this, but really just the focus of this co-located program is just to really continue to help advocates and survivors engage in this system, help them access the funds that they need to gather safety and to stay safe. And I think that it's a service that is invaluable to anyone who needs that support. So thank you for listening, and I will pass it back over to one of the organizers to move forward with questions.
Thank you, Amber and Jennifer. We appreciate all of our wonderful presenters who provided a wealth of information that will help strengthen our services. And now we're going to open up the session for questions. And my understanding is we already have a number of questions that have come through the chat box. So I'm going to go ahead and turn it over to Jennifer.
Thank you, Carol, and thank you to everybody who has submitted a question so far. The first question that I want to address, we received a couple of questions about the availability of webinar materials and if we'll get answers to the polling questions earlier related to common barriers. And so I just want to remind everybody that the webinar recording, the transcript, as well as the handouts that are currently in the bottom right of your menu, those will all be available on our Peer TA website a few weeks after the webinar. And the very last slide for today's webinar will include the actual URL. So stay tuned for that last slide for more details. All right, so our first question is for Amber. And the question is, do the safety plans include mental health counseling?
Thank you. And they can include mental health counseling, but they don't always. And so really looking at that safety plan is whatever the survivor is saying that they need. So some safety plans can be more inclusive where we're branching out to not only advocacy services, but really ongoing support around housing, ongoing support with mental health. And yes, they can include that, and they don't always, but DHS does have resources for different mental health providers in each area that they're working in, really getting connected to here's all the different kinds of people, what kind of information they're able to work with you on, and helping get connected. We also work with OHA to really look at kind of talking about what providers might be eligible through OHA, the Oregon Health Authority and the Oregon Health Plan, which is our medical, to make sure that people have access to those resources. So yes, it can definitely be included if the survivor says that's a need.
Excellent. And another question that we have, and this may be for Miriam or Jennifer. Is there a time to separate children from the survivor if he or she continues to go back to the abuser?
This is Jennifer. I think, you know, we always look at, you know, it's not my job to assess that. That's really child welfare's job. But what I always tried to do in consultation with child welfare was to really address, are there any safety concerns that we can alleviate to keep the child safe and together with the protective parent, which is usually the survivor of violence. There can be a lot of different ways that child welfare can intervene, whether the perpetrator of violence is engaging or not, whether that's through the court systems or through case planning, founded allegations of abuse, those kinds of things. But I would never say that there's never a reason to not take away temporarily a child and put them in a safer place while we help a survivor um, move forward with their plan to seek safety. But I feel like there are lots of different ways, in my experience, that we've been able to alleviate some of those safety concerns to keep the child together or children together with the safe parent.
And Miriam, did you want to weigh in on that question?
I didn't. I mean, like, I just following up on what was previously said, I think it really varies from place to place in terms of there being a standardized policy or procedure. There isn't one at least that exists in federal policy, and our survey didn't really report on that. It can be a really tricky subject because we know that lots of survivors are punished for being in an abusive relationship, with child welfare services getting involved. And I think that there's really a shift towards a collaborative model with, people trying to be as supportive of keeping a family together and a survivor with his or her children, while they try to navigate out of an abusive situation.
Thank you. And I think that's probably a good segue into another question that we received. And it states one criteria for services was to be fleeing from abuse. And I just want to clarify, I think this is, I'm going to let Carol speak to that aspect of the question, because there may be some clarification around whether that's a federal requirement or a local decision. And the question itself is, if during a victim's participation they decide to go back to the abuser, are services no longer provided? So I want to give Carol the first opportunity to kind of respond to that.
Okay, so I think that's a local requirement, Jennifer. There's nothing in the federal, in the legislation or in the statute that says anything about the number of times a person can apply for services, and especially if they're fleeing domestic violence. So the only thing I thought about was, but this is somebody that wasn't eligible, because of course we know that you can do waivers for contacting folks in child support, so you don't have to cooperate. But the whole good cause waiver that's available. So I think it's a local requirement or limitation.
Thank you, Carol.
And this is Kenya. If I can just add a bit to what's been said. And to that last question, but I think this applies to a lot of what we've been discussing. I think that working in partnership with survivors to really understand and assess what their needs are, what they've done previously and what they are currently doing to keep themselves and their children safe, and what plan they have in place to work towards independence and self-sufficiency, and to really be able to have a safe environment for themselves and their children that don't include violence as a daily part of their experience. I think it's important to really work with them together, to see them as partners and as experts on what is happening in their lives, and to empower them with more information and more access to resources so that they can really be in the best position possible to not have to be coerced or forced into a situation where they're living with someone who is very controlling and abusive. So I think a lot of it really goes back to, even when considering whether the person is fleeing or if they may have returned, what other factors are at play in those situations that there may be additional services that we can suggest or recommend or encourage them to reach out to that may help mitigate what those issues are, so they're not feeling that they're either forced or coerced to go back to an abusive partner. So I just wanted to add that around continuing the conversation with them to ensure that they're accessing all the services that may be available to help them be safe and to help keep their children safe.
Excellent points. Thank you, Kenya. So I want to address one question that we received regarding numbers, and then I want to refer the very final question that we have time for in today's webinar over to Carol. So we did receive a question about, are there any numbers about how many times survivors return to ask for benefits or assistance after being denied? And so the comment that came after that is that many times we are unable to help, either due to an eligibility issue, or an inability for the participant to successfully participate in the TANF program, or the local DV shelter isn't able to support either. And so there's a concern that those trying to seek help get kind of lost in that shuffle. So we do not, I confirmed with Carol, we do not have any current numbers that we know of folks that have been denied and then return seeking help who are survivors specifically. And then for our last question, how can we best advocate for DV TANF funding in our state? And Carol, they may also be referring to how do they sign up for the family violence option waiver. So I will defer to that, to you. Carol, are you there?
Oops, I'm sorry. Jennifer, I'm here.
We can hear you now.
All right. There's noise in the background. So was there another question? I apologize. I didn't hear.
Absolutely. So our final question, and then you can kind of close out the webinar, is how can we best advocate for DV TANF funding in our state? And I think they may also be inadvertently asking about how to sign up to participate in the family violence option waiver.
I mean, I think advocating for TANF funding, one of the things, and I heard Kenya say this earlier, is just working with your local DV advocate groups. Sometimes it helps, of course, if you're doing it from internally, but also if you have community that's making the request of your human services commissioners and also the governors, because of course, as you know, most of the TANF offices, they don't necessarily control how the dollars are spent. So I think it's working with advocacy groups and figuring out who in your state has the ear of the governor. That often helps. And then the last part of your question,
So I think maybe just some instructions on who within the state decision makers and leadership are responsible for ensuring that the state is signed up to participate in the family violence option waiver.
Right, okay. And so again, it's local. So I think if they figure out who the human services commissioner is in their state, so it's going to vary state by state. I know, like with Washington, they have a website, so you can go and find out who the human services commissioner, who the commissioner is, and reach out to them that way. But again, it's on a state by state basis, unless Kenya knows of another way for people to make that contact. I think they would just have to consult their state website.
I would agree with that. They can also always seek out more information from our website here at FISB and reach out to us here in the program at FIPSA. But if you go online to acf.hhs.gov/FISB, we can also do our part to help connect you with those programs and organizations in your state and community.
All right. Thank you, Jennifer. I know that we are out of time, and I think there was one more polling question. I'm going to go ahead and just get past that because I noticed that people were checking out, and just wanted to once again thank everyone for participating and encourage you to please visit the Peer TA website, and that's at peerta.acf.hhs.gov. And just remind people that the webinar transcript and the recording available. Give it a couple of weeks. And then if you have ideas about future webinar topics, please send those ideas to peerta@icf.com. So, again, thanks everyone for participating, and have a great rest of the day. Oh yeah, there's the feedback.